Filter compatibility is a important part of the dissolution method development. The solid oral formulations, liquid oral formulations, and the formulations for which the dissolution testing is required. These formulations contain the drug substances along with the raw materials. The drug substances and the raw materials may have different solubilities. These may be soluble, insoluble, partially soluble in the dissolution media. Dissolution testing is done to study the drug release or the percent drug dissolved as per the time, and to know the exact quantity or amount of the drug dissolved in the dissolution media over the time. We need the specific and correct sample. Filter compatibility studies are performed in the method development for the dissolution. For example, consider you are working onto a tablet formulation or capsule formulation. You are performing the dissolution. So, along with the API, there will be some excipients, or you can say the raw materials. And these raw materials may be soluble or insoluble in the dissolution media. If you take the sample without filtration from the dissolution bowl and you run it for the detection, maybe by UV or by HPLC, these insoluble particles will interfere in the correct detection of the sample. So, the dissolution media is required to be filtered before the analysis, and that's why filter compatibility studies, filter selection studies are done in the dissolution method development. Welcome, dear viewers, to this important topic onto the filter compatibility, filter selection in the dissolution method development. So, performing the filter compatibility is a critical activity. What is the purpose of filtration in the dissolution testing? We need to understand. So, filtration removes the undissolved drug or undissolved excipients to ensure the accurate test results. Because if these undissolved particles are there, excipients are there, or drugs are there, these will interfere with the results. Filtration prevents further dissolution of the undissolved particles in the withdrawn samples. For example, you have withdrawn the samples with the undissolved particles and you are keeping them for the analysis. In that period, these particles will dissolve further and it will hamper your results. That means the actual dissolution was less, but due to this dissolution after the removal of the sample, you may get somewhat higher results. This is the reason. Then it ensures removal of insoluble excipient that could interfere with the assay, or you can say with the analysis of the analyte. That's why filtration is required, and filtration is required, so performing filter compatibility becomes very important. Now, key considerations for the filter selection. So how you will be going to select the filter. First is material type, pore size, compatibility, and adsorptive properties are required to be considered. Pore size commonly 0.2 micron to 70 microns can be used. Compatibility with the drug and the media should be there, and it should not adsorb the API, because if it absorbs the API, you will get the lower or variable results. Example, if the drug particles are micronized, nanoparticles are there, choosing a pore size that retains such particles without adsorbing the drug is critical. Common challenges in the filter selection, filter compatibility studies are drug adsorption, leachables, clogging, and the volume loss. Drug adsorption on the filter, it leads to inaccurate results. Leachables from the filters may interfere with the assay. So pre-wetting of the filters can help you to avoid this issue. Clogging from the undissolved particles, especially in small pore filters. Volume loss in small volume filtration. These are the common challenges. Now, what are the recommendations? So, evaluate the filters early in the method development. Also, I will recommend once you finalize your formulation, once you finalize your method, once again go for evaluation of the filters, and also you can check the previously selected filters once again so that there will not be a bias. Then consider requalification if formulation composition changes are there, if method changes are there, as I have mentioned. Test with different concentration to assess the drug binding, because in the dissolution at the early time points less amount of drug will be released, but it will go on increasing, and at some points it will reach to a certain level. So testing with the different concentration to assess the drug binding is very important. For saturable adsorption, discard initial filtrate volume before collecting the sample, so that whatever the amount is adsorbed, that filtrate you are not going to use for the testing. You will use the fresh sample from which there is no adsorption or very less adsorption, if any. Use magnetic stirring for dissolution and compare filtered versus unfiltered sample. So by this simple technique, you can understand what is happening with the filters and how it is affecting the dissolution. For automated systems, verify flow rate and clogging potential. Special cases, USP apparatus 4 filters need to be compatible with flow-through design. Large filters reduce clogging but may increase hold-up volume and sample loss. So choosing the filter, doing the compatibility is critical activity. Now see the best practices. Always perform experimental verification using standard and the sample solutions. It is not like that only you are performing onto the samples or only onto the standards. Use both and then understand what is happening. Compare filtered results with unfiltered and centrifuged samples to ensure the accuracy. So once you are done with the filter compatibility, filter selection, this technique can help you to understand the effect of filters. So this is the information about filter compatibility in the dissolution method development. Various types of filters are available and these are required to be selected considering the scientific rationales. Thank you for watching the video. If you have any queries, if you have any questions, you can comment. I will be happy to see your comments and answer. Thank you.